Welcome back to the Grow Your Nutrition Business podcast, powered by Healthy Steps Nutrition Mentoring. At HSN, we believe something as fundamental as nutrition shouldn't be complicated, which is why we focus on a simple, habit-based approach. Our mission is to help 1 million people take control of their health one step at a time so they can prevent and reverse chronic disease. My name is Nicole Coyne, and I'm the founder of Healthy Steps Nutrition, home of CrossFit HSN and HSN Mentoring. In this podcast, you're going to learn how to take one step at a time to empower health in your community. Today's podcast guest is Dr. Christina Migliara. She is a mental health therapist, CrossFit trainer, affiliate owner, and she truly has a house of wellness located in Jacksonville, Florida. She is an amazing person and has become a great friend. We've actually partnered together to create a mental fit and mindset course, which we'll talk about at the end of this episode. Today's episode is all about trauma, understanding and how to navigate grief and loss. We talk about a lot of different things. We talk about the difference between stress and trauma, what happens when someone experiences trauma, how to cope with trauma, what gym owners and coaches can do to help their community when something traumatic happens. We also talk a little bit about scope of practice and some amazing updates in the mental fit and mindset course, which was created in collaboration between HSN and Dr. Christina. This episode was inspired in light of the tragic events that happened at the CrossFit Games and a message that I think needs to be heard on so many levels. Even if you were not at the CrossFit Games, this message is going to help you be able to navigate something that potentially could happen in the future. So I hope you learn a lot from this episode. Make sure that you click the links in the show notes. We have a couple things in there. One is a article that Dr. Christina wrote for the CrossFit Medical Society, a link to the CrossFit Medical Society directories to find mental health help. If you are struggling, please ask for help. There's some great resources through the CrossFit Medical Society there. And if you're a gym owner or a coach looking to prioritize mental health for yourself, for your staff, for your community, and you want to learn more about the mental fit and mindset course, which was approved for CrossFit CEUs, you can also check out that link in the show notes. Enjoy this podcast episode. Dr. Christina, welcome back to the Grow Your Nutrition Business podcast.
Thank you for having me. One of my favorite places to be.
You've been on here quite a bit. We've been talking a lot about mental health, mindset, coach burnout, all of the things. We just had the opportunity to share the stage together at the CrossFit Games. Speaking of the CrossFit Games, gosh, that was a whirlwind. You get off a plane, get right into action to start helping. You've been leading the way with the CrossFit Medical Society, providing mental health support for people that have been there. Talk to me a little bit about what happened.
So kind of not, what anybody I think had anticipated, being at our first CrossFit Games in Texas. But when I arrived, it was on Thursday. So it was shortly after event one. So I was literally getting a lot of information while I was still on the plane. And as soon as we landed, it was pretty much kind of hit the ground running. And getting settled in and sort of meeting up with people. I think because of my role as a mental health professional within, our industry, and people knowing that I was coming to the games, I started to get a lot of outreach and ask. And for me, and from my standpoint, it's kind of like, okay, well, you go into the mode that which crisis management, and as a mental health professional, we're very used to doing that. So my mind immediately switched from what it was initially going to be to that. And then it was just a matter of like, where can I help and what can I do? And what does that look like on a number of different layers for different people? And that's kind of what we did.
You specialize in trauma, so this is not something that's new for you. You have a lot of experience supporting and helping people through some of the most difficult times that they've been through. So you had a unique lens that honestly so many people needed in that time and are still needing today. I wanted you to come on the podcast because, obviously trauma is, something that the CrossFit space is talking a lot about now, but I think from a a bigger standpoint, we need to equip coaches and gym owners to understand how to best support our community, our staff, and our membership when and if something traumatic happens in our own local community. So I thought it would be a timely conversation to give people support who maybe have been a part of, the CrossFit Games, but then also give people tools to help support for the future. Let's just start off with big picture. What is trauma?
Yeah, that's a great place to start. And even before we kind of dive into trauma, let me just stop and talk about stress because um, stress is a natural response to, a perceived threat or challenge. We all undergo stress throughout our day. And normally speaking, we would kind of ebb and flow in and out of sympathetic and parasympathetic states so that, rest and digest, calm and collected into an activated state, depending on what we're faced that day. And when we're doing that and we're in that activated state, we're in that fight, flight, or freeze mode. And I'll talk a little bit more about that at some point. We were releasing those stress hormones, that cortisol, that adrenaline, and in small doses throughout the day, it's pretty normal. Our bodies can handle it. Our minds can handle it. It's not really going to be anything that is, abnormal. And stress can be motivating. I mean, in short bursts, it's actually good for us and helpful for us. But chronic stress can become very wearing, and it can wear down the mind and the body and create chronic issues. So process of stress, high overview, it's like you have an internal or an external trigger, which elicits this internal perception of threat. And then we create this feeling of anxiety, and that becomes very physical. It's a physical sensation. And then the thoughts come into what is happening. And then we tend to sometimes, depending on the history of any given individual, we might interpret and misinterpret and catastrophize. And that's where we can get caught in this loop of trying to understand what's going on at that moment. And once we deem it to be safe, it's no longer a threat, stress comes down. But if we are having some type of, event that we get stuck in that loop, or stress becomes chronic, and there's a lot of reasons we can get there, traumatic events and so forth, which we'll get into, that feeling doesn't go away often. It might go away upon exhaustion. We're just so exhausted from being there that we actually exhaust ourselves, and we have to relax. So high overview of stress. Now let's talk about trauma. Trauma is a very stressful event that people experience, but on a deeply and more disturbing level, from an event that occurs, and our ability to not cope kind of comes into play. So we have big T's, little T's we talk about in the trauma world. Big T's can be a traumatic event happens right in front of us. We experience a major car crash, a significant death in the family, someone we're really close to, maybe we witness death. It could be a significant transition in life. Those are kind of things that might be more of a high level, bigger trauma. And this can be a single event, or it can be an accumulation of events over the course of our life. And those experiences can have long lasting effects on us if not dealt with properly. So trauma is a lot more common than we would like to think. And people experience trauma a lot. And we're starting to learn more and more about that and those experiences and what the effects of trauma is just in the last 10 to 12 years, and all the research that's been done on trauma and experiences with trauma and healing of trauma.
So what are some of those symptoms that someone might have when they are going through one of those big T traumatic events?
Yeah, so we talked about a couple of examples, but we're going to end up going into a fight, flight, freeze, flop, or fawn response. When that happens, because we're going to survival mode, and depending on, again, there's a number of variables that goes into why one individual is going to respond one way versus another way, because it's not the same. We all perceive things differently. And because of that, you're going to see a number of different responses. And I kind of talked about that in an article that I did for the CrossFit Medical Society with respect to what I observed in people's responses at the CrossFit Games. And so from my lens, it was very evident, and you could literally watch it play out, which was, heartbreaking, right? But people are doing the thing that they think they should be doing. It's a natural instinct. It is not something that somebody is consciously doing. You've got to remember that when this goes on, everything goes into survival mode. So any function of the body that is not deemed like a necessity for that survival moment, again, we are in perceived threat, even if the threat isn't there at the moment our security and safety is impeded upon, we automatically start to go into, okay, is there a threat? Is there a threat? And our bodies and brains keep going through that motion until we deem it safe. So you might see times where things feel good and people are back to being seemingly normal. They don't have a perception of threat maybe at that moment. That could be hours, days. And then all of a sudden we see a change in behavior. And it could be because now they're perceiving threat again. So this isn't this conscious response. This is something that the brain and the body are interpreting at any given time based on a trigger that exists. And that trigger could be an internal trigger, like a thought, or it could be something that's in the environment that is triggering them. And that's why I think over the weekend, you saw a number of different emotions and different experiences and responses at any given time. It's extremely confusing. But again, the major response for that time for each individual person is to survive and to deal with the threat. So they're going to go to one of those responses, and everything is in the brain and in the body focused on that. So you lose a lot of things like the ability to have a sense of time. And that's something that I think we've heard from a lot of people. Your brain's trying to protect you and shield you from pain. So again, it's creates the inability to function like you normally would. So you've got fragmented memories and fragmented time and space. You get into that shock feeling, that denial feeling that something's happening. No, it can't possibly be reality. This doesn't make sense to me. And it's trying really hard to make sense of the situation and put you in safety. So I think that's why there's confusion. That's why there's time distortion. That's why there's, I'm okay 1 minute, I'm not okay, edginess, right? People can become very edgy and irritable. They're just trying to make sense of the world around them and keep themselves safe. And with them kind of going in and out of these emotions, it's very hard. And that becomes frustrating.
Yeah, I could see that. And you could see it watching the athletes and just how people were talking and communicating. And, traumatic events, you talked about this a little bit at the beginning, like it could be something that we've seen. There's so much research around PTSD and firefighters and paramedics and other types of law enforcement.
Military is a big population
that really struggle. I know my husband was a part of the fire department for a number of years here in our city, and the amount of people that had died by suicide just in the department that he worked with is alarming. It's scary, and people don't get the mental health support that they need. Let's talk a little bit about PTSD. Like that's a acronym that's thrown around all the time. You've got this traumatic event. What is post-traumatic stress syndrome? What is PTSD?
Yeah, so PTSD doesn't necessarily happen to everyone who has experienced a traumatic event. And in fact, one of the most important things in preventing PTSD is the response time to, the healing process and what you do with that time frame from the time that the traumatic event occurs, and on, right? And so, of course, there's a little bit of this denial that we talked about, that shock factor that's going to be there for many people. Not everyone has an immediate emotional response to things. So that's like that sense of denial, maybe even some numbness or disassociation. Their brain can't process. So they literally find themselves like being able to like disconnect from everything. And so it's not uncommon to see some acute signs. Again, going back to that irritability, the edginess, inability to sleep, night terrors, feeling depressed, lack of motivation, wanting to not be around people and isolate. Those are going to be some of those common responses when in that acute phase. If we can intervene and help promote the healing process during that time, we have a better chance of mitigating and minimizing those symptoms being long-term and chronic. Where it becomes problematic is people tend to compartmentalize. They may go through all those things, but they really try to absolve them and contain them as much as possible. And that's where I think it's really important to normalize the process to say, hey, what you're going through is a normal reaction to what you just experienced. You don't have to suffer in silence. You need to heal out loud. And, you've known that part of my mission has been to normalize and destigmatize mental health for many years, not just since I've been in CrossFit and working with you, but, my entire career. That's part of just who I am, is to advocate on behalf of people. And it's really important that we continue to do that, because that is the thing that keeps people from seeking out the help and normalizing going and getting the help that they need and thinking that they have to suffer in that silence. So we have to debunk toughness, because let me tell you something, like, those athletes are as tough as it comes. And there is nothing that is tough about, trying to push through something, right? There's pushing through, and then there's just not caring for yourself. And we are through that weekend, and it's really important to support them, the volunteers, anybody who's experiencing that, and being able to give grace and give some normalization and some validation to each experience, and then to promote and empower them to talk to someone. Even if you're seemingly okay, there's delayed onset. And again, people get really good at compartmentalizing. I mean, when you do hard things for a living and you're used to being in that activated state, it's easy to operate at a high level of stress and not necessarily feel and be attuned to what your body is telling you. But it's these after effects that will pop up if you're not listening. Your body's going to give it in symptoms. And if you're not paying attention, those symptoms will get louder and louder over time. And if we can intervene early, we really do a much better job of preventing that long-term PTSD, which is essentially just the chronic, after effect of not caring for yourself in the way that's going to help you to heal.
I want to talk about what intervening looks like, but I'm thinking about calls, yes, of course, everything that happened at the games, but taking it outside of the games, with my husband's career, they would have a terrible call. Well, someone passes away, or a little kid, or something really bad. And then they're expected to go right back into, the bunk room, and then just wait for the next call. And if they're at a busy station, they're literally just going. And I think all of that stuff just puts so much toll on people's bodies, mentally and physically, and it does cause PTSD. And I wish that more people would seek out help and find the right help for them, because not every therapist is going to be the best for you. But let's talk specifically about interventions. You talked about interventions early to prevent the long-term effects of PTSD. What does that exactly look like?
Yeah, so there in the beginning, it's very common to feel like it's overwhelming and you can't quite do it on your own. And that's really going to be strategic, where someone that's a trained professional to come in and help you, it matters. And it's going to be the difference maker. And to your point, I've always been taught there are many great therapists out there, but you're not necessarily the best for everyone, right? So you have to have some self-awareness as a professional. Rapport and connection is the primary differentiator in someone being successful in this process. And you will be 5 times more likely to be successful in your mental health journey if you are connecting with the person you're working with, as opposed to just choosing someone just to choose someone and go through the motions. It really does make that much of a difference. So one, doing some research, which I know we don't have time and nobody wants to take the time often to do that. But if you want the right fit, then you need to do some research and find the person for you. We are very lucky in our space that we have this newfound CrossFit Medical Society that literally gives you a directory. And the last I knew of, there was over 200 mental health professionals listed on that directory.
Wow.
So that's huge compared to prior to the games when there was like maybe 12 of us. And this is worldwide. So I feel very proud of my colleagues for getting on that list. But there are ways to find people, look for certain credentials, people who are trauma informed, and do a little bit of research on EMDR and other trauma informed approaches. So that's going to be a step. And then that person can help work through in a safe space the initial steps to unpacking and working through that trauma. And that's really a key differentiator, because what happens is when you're on your own, you don't feel safe. You don't know what's going on. You can't quite figure out why you're responding the way you do. This is not a conscious decision. These are unconscious. This is like buried in the psyche, and things are happening. Your body's responding in certain ways. Your thoughts are coming, and you're doing things that you wouldn't normally do. And it's very scary because it catches you off guard. And that's how powerful triggers can be. And so you really want to know that you're in a safe place where you can do that work. And that in the beginning, early on, is going to be important to do with a trained professional. They're going to be able to assign you other things. And there's a lot of stuff out there that you can do on your own time, because the work doesn't stop just after that 1 hour that you're in the session. It's going to be what you do after that. So a lot of mindfulness practices, because now your nervous system it's not regulated, and it needs to create that regulation. And in order to do that, there's work that goes into actually doing that. It's not something you can just think yourself in. I want myself to be regulated. It doesn't work like that.
You
So
mentioned
there's a lot of things you can do. Yeah.
You mentioned EMDR. I want to talk about it for a second. I can personally share from my experience that this has helped me tremendously through different traumatic events that we've been through over the past year or so. What is EMDR for those people who've never heard of it before?
So EMDR is a specific approach, trauma-informed approach, that uses particular like tools and mechanisms to help with the brain and body connection. There's been a lot of studies and research that supports its efficacy, and a lot of people really enjoy it. Some argue there's not really any person who couldn't benefit from it, but again, there are approaches that work for some and not for others. There are some basic EMDR things that like any therapist might do. I even use some of them in my work, but I ascribe more of a somatic experience styled approach. So it really just kind of goes into what works best for you. But again, EMDR is going to work best when you're in person. And it really does create this literal re-hardwiring of the brain and connection with the body, and helps to regulate the nervous system again. And that's just kind of like a high overview explanation. But
Okay, awesome. Thank you. I had never heard of it before I started doing it. So I'm
yeah.
sure that some of our listeners are like, what is that? So I wanted to pause there. Let's kind of shift gears. Lots of gym owners and coaches listen to this podcast. Maybe they've experienced some trauma, or maybe they're realizing someone in their community is struggling. Like, what can you do as a gym owner, as a coach, even bringing in nutrition coaching into the experience?
Yeah. So you're a part of their support system. The moment they sign on with you, they are creating this journey, and they need a team of people along the way to provide that support and accountability. So know that your role continues to be that. So if it is disclosed or it comes up that there's a traumatic history, or someone recently experienced a traumatic event, we know that that's going to create inevitably at some point some mental blocks for people.
Yeah.
Let's make sure that we're being safe for them. There's no judgment. There's no, looking differently or down upon this person for having these experiences. So creating the safe space yourself by making sure that they know that you're a safe person, because they're divulging important information to you, and that's not easy for people to do. So there's that. And then I think the second thing is being able to stay in your lane. That's always a big thing for me. Like, you're a part of the support system, but you're not a trauma-informed therapist. So
Right.
I think even saying that, like, hey, that's heavy. I can see how this can become a barrier to our success. And I definitely don't want that to get in the way because it doesn't define you. But in order to do that, we need to get you in contact with someone who can help you work on that piece while we do this piece. It's not an either or, it's an and. And that's just one more piece of our plan, our treatment plan. So I have this list. These people are on my list. Make sure your list has trauma-informed, therapists. They're great. They're in our community. They're accepting new clients. I think you would really like them. Take a look, give them a call, make that part of their goal. So that way, when you check in with them, hey, did you follow up with that therapist we talked about? I did. I have an appointment. Fantastic. I didn't. Okay, what's holding you back? Just like any goal, this is part of that. And we want to hold them accountable for that too. Because trauma explains a lot of people's behaviors when they've gone through it. Like you can look and you can be like, okay, I totally get now that I know that why. But it doesn't excuse it. And if you don't do something about it, it'll become your ongoing excuse for your behavior. And that's only going to get in the way of what your true potential looks like and what you want in life. It becomes a barrier. And for many people, it becomes a silent mental barrier that you have deep in you that nobody gets to see. And this is why we're like a bunch of floating icebergs, right? Because people only see what you allow them to see on the surface, and they don't know what's going on the inside. And this is why it's so important to be kind and like just treat people with grace, because you only have a little bit of the story. So be more curious instead of being so, quick to judge. Ask questions. So just to recap, be safe, have referrals, know your role, and be a part of the support team and encourage them to reach out, and then hold them accountable for it.
You gave a great example of how you might just not, you kind of role played with yourself, but what you might say to someone to encourage them to, go see a therapist. That sounds really heavy. Have you considered going and talking to someone about that? And we've talked about this before on the podcast. You've talked about it in person, but having a list as a gym owner that are practitioners that, you've kind of vetted yourself that would be a good referral source for you to send someone to. We have therapists in our gym. Maybe someone would feel comfortable going to them, but maybe they wouldn't. And if they wouldn't, I would be talking to that therapist, like who's someone that you would trust? Like you're in the space, who would you trust? And then also going to the CrossFit Medical Society, looking at the directory there, sending your members there. It's completely free to join the CrossFit Medical Society to see all those practitioners. And you just mentioned it's like gone up astronomically with the amount of mental health practitioners in there now, which is really good. But I think it's so important that we do that gentle nudge to guide people. And then, from a physical standpoint, if someone's in class and they're struggling, like, hey, I'm so glad that you're here. Like, you don't need to push yourself to the limit every single time. Like, you're here, you're moving. We know that exercise is going to help someone feel better. The endorphins that are released after them getting into a supportive community, instead of isolating themselves, but, give people grace, right?
Yeah. And, it's interesting because I just want to touch on and give like this example based on what you just said, because people will sometimes still show up like, I got to just work out, right? Again, they'll gravitate towards being activated because that becomes safe. It's something that's familiar to them. It feels safe for them. So they will come for some people, because remember, everyone responds differently, and they will work out. But we aren't meant to stay in an activated state. So even exercise now, what was once something we used for health, is become detrimental to our health because we're using it to compartmentalize to avoid the thing that we don't want to talk about. And this helps me to feel safe and not think about that. And so imagine I gave you like a 40-pound dumbbell and I said, I want you to work out your left arm. Okay, you can snatch it, you can clean it and jerk it, you can curl it, whatever you want to do. And then your right arm, I'm like, here's a 5-pounder, and you can kind of do some curls and some presses periodically. Over time, what would you look like physically to the eye? Pretty disproportionate, right?
Yeah.
You might look a little funky. I'm like, Nicole, what's up with you? Why is your left arm like jacked and your right arm is like, what's going on here? That is exactly what people look like on the inside when they don't have a regulated nervous system. When their vagal tone is low and they haven't done the work to work on both sides. I mean, we have to take the time to work on our parasympathetic part of us. We have to be able to rest and digest and do all the things that the benefits that come with that. But we've glorified and normalized high stress living, particularly in
Yeah.
our country. And that
Yeah.
is a problem. So there's a lot of people walking around internally
Yeah.
with this really odd looking biceps. One is really jacked and they're really good, and the other one is just really not.
Hanging on by a thread.
Hanging on.
Yeah, you bring up a really good point, like going back to the games or, any other traumatic event, like we're in this bubble and then we go back and we've got a million things going on. We've got kids, we've got work, we've got all this stuff, and we probably didn't give ourselves time after the games to process or after a specific traumatic event happens, giving us a little bit of grace. Like, maybe your 100% isn't 100% today, maybe it's 50%, and you have to be okay with that to give yourself
100%.
the grace to be able to move through it instead of end up being a block for you.
Yeah. Again, jumping right back into being activated. I'm home. I don't want to think about that. So I'm going to go, into being busy. And
Yeah.
busy is code for I don't know how to be still. And if you don't know
Yeah.
how to be still and quiet, you're at war with yourself. And that's a problem.
That's one of the pillars of your mental fit and mindset course with the hygiene routine, quiet time. I know it was a struggle for me. Hobby is also definitely a struggle for me too. You let me know my gym and exercise is not a hobby.
Just
Uh,
not.
I want to shift gears just for a minute. You created a mental fit and mindset course, is the first one approved for CrossFit CEUs, all talking about how to prioritize mental health, not mental illness, but really getting people to be firing at all cylinders. We did this course in collaboration. So there's a lot of tools and resources. We've added some really cool things to this course. One is when we started looking at all of the research around employee wellness and what companies are wanting. They're wanting not just nutrition and health, but a lot of mindset and support. So you worked with us to create a special 6-week employee wellness challenge that's available in the Healthy Steps Nutrition app for HSN mentoring clients. So it's a game changer for them to be able to expand their reach and serve people beyond just the walls of their gym. I personally love doing employee wellness because it's people that would have never stepped foot inside of our gym, and we could really impact their health and their wellness. But this past season, specifically after the CrossFit Games, you reached out to me. You're like, Nicole, I think we need a module on trauma to take
Yeah.
a deeper dive into what we talked about today on this podcast, but really giving gym owners tools and resources. Want to talk about that for a minute?
Yeah, it's definitely been something that's been on my radar. And I think this just kind of solidified that for me even more because, like I said, trauma is far more prevalent than we really had, given light to. And it's something that we need to be aware of and have insight to so we know what to look for and then we know how to navigate those waters. Because again, this course is designed to empower and to educate so that you can take action and feel confident in the action that you take. So adding this module, I think, is going to shine a little bit more light on this topic, talk about a normal stress response versus a trauma response, how people can get stuck, how the healing process should look and could look, what's your role in that, even goes through a little bit more into the different responses and why someone might fight versus flight versus freeze versus flop versus fawn. And kind of debunks some things. And I think that's only going to further educate and empower our gym owners and coaches and make you feel like you can navigate those waters. Because the last thing I want is someone to be like, I'm not touching that. Like, what she just said? Yeah. And shut people down because it's so invalidating, right?
Yeah.
Like just to be like, that's above my pay grade. Like, that's not what we do here. Sorry.
Yeah.
And we could really be using this as a tool and a vehicle to help them if we know how to approach them properly. We're in the business of relationships. We have to know how to handle a number of situations. It's both the blessing and the challenge for us.
Yeah. Absolutely. Well, I'm excited about the continued support that you're providing affiliate owners in the realm of mental health and prioritizing mindset. Excited for this new module to come out, which it should be done by the end of September. If you've already taken the mental fit and mindset course, you're going to automatically have access to this module. Just go back into the course. If you haven't yet taken the course yet, sign up and you'll get access to this module as well. I know, Christina, you are planning to do a shortened version, like a free training for this. And if people click the link in the show notes or follow us on Instagram, we'll put the Instagram handles on in the link in the bio. They'll be able to just get that quick download to that free shortened training as well, specifically on trauma. So thank you for all
Thank
that
you.
you do. Thank you for making those additional trainings for the course and just for the community at large. Any final thoughts as we wrap up today?
No, I think it's just, a great opportunity to, again, just reset, realign, restart, reclaim, reignite. Like, this is what we need to do, and we need to do it methodically. There's still quite a bit of healing that we need to do. Again, time is distorted. We're only a couple weeks out, and a lot of people are still feeling all the feels or not. So I think it's a great time for us to provide some more insight and education, and thank you for the opportunity to do that. I know that I can probably speak on behalf of a lot of us in this industry. Like, our goal is to help and to, change lives. So let's do it.
Dr. Christina has such a wealth of knowledge in this area and such a passion for serving our community of gym owners and coaches. If you want to connect with her, make sure that you check out the links in the show notes. You can also check out the mental fit and mindset course. We just talked about those updates. There are some really incredible things that are available to gym owners and coaches, especially if you are in HSN mentoring. We've built out programs in the HSN app for mental health, mindset, a challenge, individual coaching, and an employee wellness program, which are all amazing. So make sure that you check out those. And don't forget, if you are needing some mental health help, don't be afraid to ask. I would recommend going to the CrossFit Medical Society directory to find a mental health professional near you. Shop around, look for different resources, find someone that you connect with. Christina talked a little bit about EMDR. I've personally seen really good success with that. So you can always ask potential therapists if they use that method, if that's something that you're interested in. It's really helped me a ton through some various stages in my life. Hope you enjoyed this podcast episode. Don't forget to subscribe, leave us a review, and we will see you back here soon.